Okay, all right, so I have Jane Dickinson for scenario. You're taking care for a client with a bowel instruction, so she also has a central line in place, and she'll be receiving chemotherapy. So we've got 0.9 normal saline solution running right now at TKO, and she's currently complaining of severe nausea. So I've got her chart here, and so I'm just gonna check her chart over, and take a look and see what we all need. Kind of figure out what I'm gonna do first. Check the order. Just check over all of her allergies. Make sure that everything I gather, that I don't gather anything she's allergic to. And I'm gonna gather up all of the supplies that I need, and then go on and talk to Jane. So I'm gonna wash my hands up. Knock, knock, knock. Hi, Jane. My name is Lane. I'm gonna be your nurse today, and I understand that you are feeling kind of nauseous, and I see you have a little bit of low blood pressure, and then you also need an NG tube inserted today. So I'm gonna get all of that stuff going for you. Besides the nausea, are you feeling okay? Are you feeling anything else? She says no, she's just nauseous. Okay, so I'm just gonna check your name here and date of birth, Jane. You can verify your first and last name and your date of birth.
Jane Dickinson.
And 32433. Okay, thanks, Jane. All right, so I'm just gonna close this up here. All right, so the first thing that I'm gonna do is I'm going to get an IV bolus running for you of normal saline to try to get your blood pressure back up, okay? All right, so I'm gonna get that all set up for you. All right, so I'm gonna grab your chart here, and I see that she has an IV bolus of 500 mils of normal saline to infuse over 3 hours. So I did my math, and we're going to be running that at 167 mils per hour. So let me grab this. And I've got 0.9 normal saline, 500 mil bag. I'm just gonna check the expiration date, and then check to make sure that there's nothing in this bag and that everything looks clear. I'm just also gonna keep in mind for compatibility what she has ordered and what she has running, and she just has normal saline running right now, so it's compatible obviously with that. Since I did my math and I know that I need to do 167 mils per hour, I'm just gonna come over here and just do my 5 rates 3 times, make sure I've got the correct thing. So I've got Jane Dickinson here, a date of birth 3/24 of 1933. Got sodium chloride, normal saline. It's a 500 ml bag to infuse over 3 hours. Did my math, it's 167 mils per hour, and that's gonna be due right now. So got Jane Dickinson, and I've got 0.9 normal saline, and it's a bolus of 500 mils to infuse over 3 hours, which is 167 mils per hour. That's going to go through one of her central lines here, one of her other separate lines, and it is due right now. And one more time here, we've got Jane Dickinson, and I've got a bag of 0.9 normal saline to start her IV bolus of 500 mils, which is going to be set at 167 mils per hour, and it's going to go through a separate central line for her, and then it is due right now. Okay, so I'm going to just wash my hands back up and then put some gloves on and get this all set up for you, Jane, okay? And I've been talking with Jane kind of the whole time, just making sure that she's oriented and kind of understands like what's going on, and Jane, if you have any questions at any point or anything, or if you're feeling anything out of the ordinary, please let me know. I'm here to answer any concerns you have or anything. So just let me know if you have anything that you want to talk about. Make sure this is locked off. So, I'm gonna get my tubing primed up here. Make sure there's no bubbles in the line or anything like that.
Mm-hmm.
All right, so then I just make sure that there's no bubbles in your line, and it looks like you're good to go there. So I'm gonna pick guardrails, IV fluids. We've got her bag of 0.9 normal saline. Yep, and it's already infusing. Already infusing on channel A, but just at TKO. So we're gonna say yes, 0.9 saline. All right, so we're gonna run this at 167 mils per hour. And because it's a bolus, we're gonna do 500, the whole entire 500 mils bag. Okay, all right, and then that's all set up. All right. Okay, so I'm just gonna take a look here at your central line site. Jane, are you feeling any pain at your line or anything out of the ordinary? And she says that she's not feeling any pain, so looks like, and I don't see any redness or anything like that, so looks good. All right, so we're gonna get this wiped up, 15 to 30 seconds. And then I would also be thinking about the fact that does she still need a central line? And she does. She's going to be receiving chemotherapy through this, so that's something that you definitely want to think about too. Okay, so I'm going to get... Alright, just make sure that this looks all good. And I know that I already have gloves on, but I would be wearing gloves while I was doing this, and I think I already said that I had gloves on before, so just make sure that this all looks good and it's running and looks like the pump is going, so should be good to go with your bolus now, Jane. Okay, all right, so I'm gonna take my gloves off and wash my hands up. Okay, all right, so then The next thing that I'm gonna do, Jane, is I'm gonna get your medication running for your nausea. And so the doctor's prescribed Zofran for you, which is a nausea medication, and I'm gonna be giving that to you through your bolus line right here, so I don't have to poke you with a needle or anything like that. So just give me a second. I'm just gonna get this all set up for you. Okay, so I've brought my Zofran in to the room, and just double checking my chart. I checked in the Betty book for giving an IV push of Zofran, and this can be given undiluted, and we can give this push over a 2 to 5 minute time span. So just checking, making sure, like I said before, if she had an allergy to it, we wouldn't be giving this to her, but she does not have an allergy to this. And I did my math here for the Zofran, and we have a pre-filled syringe of Zofran available, and it's 6 milligrams in 2 mils. I'm checking my expiration date, and it hasn't expired. So doing my math, she needs 4 milligrams of Zofran, and so that would be equivalent to 1.3 mils of Zofran in this pre-filled syringe. So that's my math for that. So I'm just gonna come over here, and actually I'm gonna be a little bit easier. Okay, I'm gonna get this all set up for you, and then get this dose accurate. So I'm gonna wash my hands up again, and I would put on a new pair of gloves, and then I'm gonna get this dose accurate to 1.3 mils. Okay, make sure all of my bubbles are out. And we got 1.3 mils. Make sure everything's out, no bubbles. There's no bubble in there, so we got 1.3 mils.
Good.
Okay, so I'm gonna label this 1.3 mils of Zofran, and then I'm gonna bring this over and also bring over a alcohol wipe. And then Jane, could you just verify your date, name and date of birth for me again? And she says Jane Dickinson, 3/24 of 33.
Yep.
Just double checking that. Okay, so I'm gonna do my 5 rights 3 times here with this medication, just to triple check. So I've got Jane Dickinson here, and Jane Dickinson, and I've got Zofran 4 milligrams IV push, and that is every 8 hours as needed, and she has not had it in the last 8 hours, and so I'm going to be doing it IV push through her central line. Jane Dickinson, date of birth 3/24/1933, and I've got Zofran here 4 milligrams, and that's IV push every 8 hours as needed, and she's not had it yet. And then one more time, I've got Jane Dickinson here, and then Zofran 4 milligrams IV push every 8 hours as needed, which is the equivalent of 1.3 mils of this concentration. She is going to be getting that IV push through her central line, IV bolus, and she has not had it at all yet in the last 8 hours. So, all right, so I'm going to set this over here, Jane. Now, so I know you're feeling nauseous, and this should help with that. And then some side effects of this medication will be dizziness. That's one of the main side effects. So if you're feeling dizzy or if you're feeling anything out of the ordinary at all, just please let us know. Use your call light and get somebody. Don't get up on your own or go to the bathroom by yourself. Just make sure somebody's with you so that you don't fall, okay? All right, so I have my gloves on already, but I'm gonna wash this up. All right, so I'm gonna be giving this through her IV bolus line, and this port closest to her. So we'll clean this off for 15 to 30 seconds. Be thinking about if she was confused or having you know, issues or anything like that, or she's like an older lady and kind of didn't know what was going on, you might want to have another person here with you, kind of help you out. All right, so then it's all cleaned off, so then we'll be giving this over 2 to 5 minutes. We'll just say that that was 2 to 5 minutes.
Mm-hmm.
Okay, all right. And then should be all good to go with that. We don't need to do any saline flushes because the line is running. So I could throw away all these supplies, get rid of this. Are you doing okay, Jane? And
Yep.
She says she's doing good. Okay, good. All right, so I'm gonna wash my hands back up. Okay, all right, so Jane, the last thing that we're gonna do is I'm gonna get your NG tube going for you, and that is a tube that's going to be going down your nose into your stomach, so that when you need, or when you're not NPO, because you are right now, we'll be able to get you something to eat that's for your bowel obstruction, okay? All right, so I'm just going to move this over here a little bit. Okay, so just check your chart again, make sure, yep, that you definitely do need this NG tube. Okay, so I'm just gonna check, actually gonna check this wall suction before I lock myself in here. Just wanna check to make sure your suction is working. All right, so I put on low intermittent suction. Make sure that that's working, and it is. So we'll just put that right over there. Okay. And wash my hands again. Okay. All right. So, Jane, I'm gonna just check your nose and just make sure that your nares look good for your NG tube. So I'm just gonna just check inside your nose, see if I can see anything, check your mouth. You are NPO, so I won't be able to give you any water to help swallow the tube down, so we're just gonna have to kind of swallow dry once I stick the tube down your nose, and it'll kind of go down your throat into your stomach. But I'll kind of guide you through it as we're going. So I would probably put gloves on at this point, because I feel like if you're touching a patient's face, you probably would want to wear gloves. So I'm just going to occlude your nostril, and can you breathe for me through the nostrils? And then is there one that you're able to breathe through better? And she says that either one is fine. So I'm going to go through her right nostril, it's because it'll be easier for me and closest to me. Okay. All right. So I'm gonna get a couple supplies here. I'm just gonna put this right here in case you feel like you need to cough or anything. And then I'll give you this in case you're feeling nauseous, and some Kleenex. All right, so I'm gonna measure here kind of how far we're gonna want to try to get this tube down your throat and into your stomach. So I'm going to measure from your nose to your ear, and then down to your xiphoid process here. which is just this bone right here by your sternum. Okay, and then you can either use a piece of tape to mark it or mark it with a marker. Either one would work just fine for placement. Okay, all right, so now that I have that marked up, I've already got my gloves on, and I could get a piece of tape kind of ready for her to put on her nose when done. And I know like at Aspirus they have like special tape that you can use to put on a patient's nose, kind of like a gentle tape for NG tube, but otherwise you can just use a piece of grip tape all prepped up. Okay, all right. So I'm gonna get this over here and lube this up. Get that lubed up for you. All right, and I've got you kind of already all sat up. So you're in position. So I'm just gonna kind of have you just relax for a second. And I'm gonna push this in straight back. All right, and then you can just relax. So I'm gonna kind of push straight back first. And then it'll kind of go with your, kind of with the curve of your oral pharynx and your nasal pharynx and just kind of go down your throat. All right, so now that I have it in a little bit, I'm just gonna have you kind of sit up forward for me a little bit while we kind of move this down, and then if you're able to swallow, go nice and slow here. Are you doing okay, Jane? And she says she's doing okay. If the patient would be like gagging, I would want to stop and give her a second, especially since she can't really swallow anything. So just move all the way gently. Stop if I felt any resistance. Okay, all right, there you go. Okay, so now that I have this up to the line, I'm going to get some skin prep, and then I would skin prep her nose up, and then use the tape. And then kind of go around the tube and then secure it so that it is taped up there really good so that it doesn't move. Okay, this tape's not very sticky, but you would definitely want to just make sure that it was taped up good so that it would kind of be in the same spot. Okay. All right, are you doing okay, Jane? And she says she's doing okay. Are you feeling a little bit better from your medication yet? She says she's starting to feel a little bit better, so that's good. Okay, so then we have to check for placement before you can attach any suction. So we would call X-ray to come in and verify placement before you did anything. And while you're waiting for X-ray to come, you could check, well, you would probably check the stomach contents with the syringe. So you could check the pH of that. And then just once X-ray comes in and verifies placement, then you are good to go with anything that you need to do with the NG tube, with feedings or medications or anything like that. So then I could pin this right here, and I would attach to suction, and then would have it on the low intermittent suction for her. You're doing okay? Oh, oops. That's not right. Attach it to low. There we go. And then make sure that this is all good. And make sure that this is working, and stay with her just to make sure that she's doing okay. Okay, all right. I think we've got everything all set for you, Jane. Are you feeling okay? and she says that she's feeling okay. Okay, so then I would just make sure Jane was comfortable and give her her call light. And then gather up all my supplies and throw everything away that I needed to, clean everything up, wash my hands up, and then document all of the stuff that we just did. So go into the room and document your IV bolus, the amount, the expiration date, all the information for your bolus, and the mils per hour that it's running. Document your Zofran and all of the information with that, the dose, the route, the time given, how your patient reacted to it, and then also documenting everything for the NG tube, including the measurement that you took of how far it is down, so you can check the placement for that every 4 hours and make sure that it's not moving. And let's see, anything else documenting for NG? Just how your patient reacted and the time that it was inserted, and I think that should be it.